Hi, my name is Shirley Washington, and today I am going to be doing my central line dressing change video. I am a 366 learner in section 2. I have practiced, so I have opened my dressing kit just to verbalize that that's why it's already opened. So yeah. So I would, of course, make sure to identify my patient, make sure I'm doing the dressing change on the correct patient, and that it is time for the dressing change to occur. I would perform hand hygiene and apply my mask and apply gloves. And I would instruct the patient to turn their head away from me while I'm doing the dressing change, or I could give them a mask as well. So here's how I have my central line set up. I do have to tilt, in order to be able to see, I've got to tilt my screen down a little bit, but I'll try to keep my face in view as much as possible. So I'm going to go ahead and tilt down here. Okay, so mask on, I got clean gloves on. I'm going to stabilize my catheter with my non-dominant hand and gently, on each of the four corners, I'm going to gently pull up and out to remove the old dressing while maintaining the keeping the catheter stable. So I would remove and discard the old dressing, and then I would make sure to inspect the catheter site. I'm making sure the skin is intact, checking for any redness, making sure that the insertion site for the catheter is looking as it should be. I would remove my gloves, and I would perform hand hygiene. So, perform hand hygiene. I'm going to go ahead. I would open up my tray here. I'm going to slide this down. I just want to be able to be putting on my gloves. I'm going to move him out of the way so that I can show gloves. Okay. So go ahead and open that and get my gloves ready here. So being sure these ones are really small. Oh, sorry. So making sure not to touch the outside there. And then I'm going to pick up here. Make sure I got the thumb on the right side this time, which is right there. And sorry, these gloves are a little tight. And get my gloves on as such. There, and just paying attention to, of course, keeping, gloves above the waist level. So I could discard my wrapping here. I am going to go ahead and bring my guy back over so you can see him. So I bring him back over here. Whew. And then I could go ahead and use this. I would break it because this is the chlorhexidine, I think. You don't, you go back and forth for 30 seconds. I want to be able to see that, so I'm going to move this down here. So for 30 seconds, a back and forth motion. just to ensure that's clean. Then I would discard that. Make sure that it dries completely. So it needs to be completely dry. Just for video purposes, I'm going to use some gauze just to wipe it up because I don't know if this will dry on my box here. But you would allow that to completely dry. You would not do this. You would allow it to completely dry before applying the dressing. So after that, after I would go ahead and get my dressing. And I would apply that over my catheter here. So I would have my dressing applied. I would use this piece here to put my initials, date, and time, and I would add that to the dressing as well, so that others know when it was done and when it was changed. I would then be able to just take off my gloves and perform hand hygiene. And that is it. Thanks.